So here is the only thing that you need to do about glycogen storage disorder. So there are these many storage disorders, and let's start with the type 0. That type 0 is because of something called as glycogen synthase. There is nothing to remember in this type 0. They cause early death. There's nothing to remember except that, okay, if you want to remember the enzyme which is responsible, which is glycogen synthase. Forget that. Now the first one, which is very important, is von Guerki, and it is because of glucose 6 phosphatase enzyme. Okay, what is the enzyme? Glucose 6 phosphatase. Von and 1. So 1 is von is von Guerki. Von Guerki is because of glucose 6 phosphatase. Now von Guerki में बहुत सारी चीज़ें होती है. First is hepatomegaly, renomegaly. And why is this megaly happening? Because glycogen is accumulating. Okay, so they will give you a picture where this person has hepatomegaly and renomegaly, and they did histopath and they found a lot of glycogen accumulation. They found that this person has severe fasting, hypoglycemia, growth failure, lactic acid is increased, uric acid is increased, and lipid is increased. Okay, so there's hyperlipidemia, there's hyperuricemia, there's lactic acid which is causing acidosis. So all of this picture is going to be talking about von Guerki, which is a type 1. This will be a straightforward question. They'll give you this person has hepatomegaly, renomegaly, which is very important. These are all clinchers. Lactic acid, uric acid, or lipidemia. ये तीनों बोल दिए, that means it is von Guerki disease. Okay, remember all the highlighted ones are the key ones. Okay, so lactic acid increase, uric acid increase, or lipid increase is von Guerki. That is done. Okay, second is pompase. Okay, 2 is Pompe. You can remember it's very cute. 2 and Pompe are together, and it is because of enzyme which is alpha 1 4 glucosidase, also called as acid maltase. Now over here the clinical feature will show cardiomegaly. If there is cardiomegaly and they are asking you which glycogen storage disorder it has to be Pompe. So glycogen cardiomegaly, heart failure, directly you have to go for Pompe. You have to look for only this thing, that is Pompe, which is the second one. Third is Cori. Okay, number 3 is Cori, and 3 is Cori. Over here you should remember 3, 4, Cori and Anderson. So it is A is Anderson, B is branching enzyme, C is Cori, and D is debranching. So it is A, B, C, D, where Cori is 3 and Anderson is 4. Okay, so 3 is Cori, 4 is Anderson, Cori is debranching, Anderson is branching. Now what to remember in Cori? Cori has a very similar picture to von Guerki. It has hepatomegaly, but over here when they see histopath, it is because of branch polysaccharide accumulation, not glycogen accumulation. So that will be your sort of like a differentiation, how to differentiate Cori with von Guerki. Von Guerki has glycogen accumulation, Cori has this branch polysaccharide accumulation. One more thing is that they'll have normal lactic and normal uric acid. So even though they'll have growth retardation, which is similar to that of von Guerki, hepatomegaly be similar hai, but when you see the lactic and uric acid, that will be normal. So that is how you differentiate. Okay, Cori will be debranching enzyme, von Guerki will be glucose 6 phosphatase, and von Guerki will have increased lactic, increased uric acid, and increased lipid, which will not be seen in your Cori's. Fourth is Anderson. Anderson is not very well, asked in terms of clinical features, but you should remember that type 4 is Anderson, and it is caused by branching enzyme. उसके features भी similar, hepatomegaly भी इसमें भी होता है, and इसमें what you will find is polysaccharide with some branched points. Okay, that is what you get, polysaccharide with some branched points. And not everything will be branched. Like Cori's may you get all branched polysaccharides only in the hepatomegaly, but over here only some of them will be branched, some of them will remain unbranched. And then Anderson, remember it is type 4, but the death is by 5. So you can remember type 4 Anderson, death is by 5 years of age and failure to thrive. So bas utna hi hai, that's why it's not very well asked. What is most asked is von Guerki, Pompe, McArdle, maybe Tory. So all of these you have to remember very well. Now the fifth one is McArdle. McArdle is very, very, very important. It is because of muscle glycogen phosphorylase. So now McArdle, M for McArdle, M for muscle. So McArdle is because of glycogen phosphorylase, and the features is it causes exercise induced cramps. It will cause renal failure because of rhabdomyolysis and myoglobinuria. There will be second wind phenomenon. Matlab when they continue to exercise, they will feel better. Also McArdle is because of muscle glycogen phosphorylase. exercise-induced cramps, renal failure because of rhabdomyolysis, myoglobinuria, second-wind phenomenon, and when you give them a carbohydrate-rich diet, myocardial people will improve. Okay, so that is important, this improve point. Okay, so this is myocardial. Sixth one is HERS. HERS is also very non-consequential. It is because of, now we did muscle glycogen phosphorylase, so HERS is because of liver glycogen phosphorylase. Okay, so myocardial and HERS. And it is a very benign condition. Liver glycogen phosphorylase nahi hoga to bhi that person can survive. It can be presenting with a little bit of hypoglycemia and muscle weakness and all, but otherwise they are fine. The seventh one, which is TORI. TORI is also a little confusing. It is because of muscle phosphofructokinase. Okay, PFK hota hai usme muscle mein, which is deficient. They also have exercise induced cramps. They will have no second wind phenomenon. Matlab, even if they continue to exercise, they will get worse. TORI people will get worse. Myocardial will feel better. One clincher is that there's hemolytic anemia in the question. Okay, there's hemolytic anemia which is associated with some glycogen storage disorder. It has to be TORI. So whenever they say hemolytic anemia and GSD is there, it has to be TORI. When they say second wind phenomenon, then try to relate to myocardial. When they say there's uric acid, more lactate and more lipid, it is von Guerki. When they say that there is cardiomyelitis, Pompe. So this is how you will differentiate, and you can fatafat answer questions.